I'm Dr. Dan Carlin. I'm the founder and chief executive officer of WorldClinic. The greatest inspiration for me to become a physician was my own father. Growing up as a kid in Western Massachusetts, my father was literally the doctor to our small town. And I was an almost daily witness to the impact he had on people's lives. It was pretty awesome to see as a little kid, making someone better, making them less anxious, getting them out of pain, healing a condition, addressing an anxiety or a fear. He absolutely impacted people's lives in a really, really positive way. I started WorldClinic primarily because I had a very unique background as a young physician. When I got out of medical school, I went to the U.S. Navy, a year at Bethesda Naval Hospital, and then 2 years aboard USS Mississippi. We were a nuclear-powered cruiser, which was significant because it really meant we patrolled alone without any support ships. I had several cases over those 2 years where I needed to call for help. So I, as the general medical officer, could sort out whether a young sailor had an appendicitis, or in one case, even cancer. So this seed of calling for help from far away was planted very early in my career. After I was released from the Navy, I spent a year overseas as a refugee camp doctor. Again, often in a situation where I did not have the expertise in infectious disease, for example, or pediatrics or trauma to do the job I wanted to do, and I had to call for help. These were foundational for me as a young doctor. When I came home, I did a residency in emergency medicine. I went into practice, and at about 3 years into practice, I decided to start a simple telemedicine practice for ships. That practice ultimately grew into WorldClinic. The thing I find most rewarding about being a physician is the impact you have on people's lives. And not just the individual patient, but their family, spouse, children, parents. I'm trained in emergency medicine, so we see everything. And I mean everything: neurology, cardiology, ophthalmology, pediatrics, and on and on and on and on. And you're the first line, if you will, in our nation's healthcare system. So I have a very broad scope of knowledge, and it's immediately applicable in the emergency room environment and in the WorldClinic environment. We only hire physicians with a very, very broad basis of knowledge. And if we don't know what it is, we have the resources to get even that higher level of expertise. For me personally, the big reason was, changing people's lives. But now, as the internet and technology has improved with each passing year, it's just fun too. I'm having a lot of fun creating things, inventing things, doing things for the first time. Doing a concussion check on a 2-year-old on an iWatch or an Apple Watch, or seeing a patient on the other side of the world their third day after maybe a huge laceration or a coral cut. 20 years ago, they would have been terrible pain and a horrible infection. And now I see them and they're on the right medication and they're healing. So there is a fun component and a professionally rewarding component to this too. The thing that motivates me to do my best work every day is the knowledge that what we're working on is just the beginning. We are only 3 or 4 years into the mainstream adoption of telemedicine. And there's so much more to do and so much more coming. I believe personally by the end of my life, a huge amount of medical care is going to be taking place via the phone in your home. And it'll be everything from monitoring chronic conditions like epilepsy, hypertension, depression, all the way out to you've just been discharged from the hospital from a major procedure, but you've been equipped with the right monitoring equipment, and we've set up a video link to check on you, and we've already ordered all the medications you're going to need and the visiting nurse that you might need, and all of this is going to happen fairly soon. To be perfectly frank, I'm positive this is going to happen because demographically it has to happen. And so when I look at my work, I'd say, yep, we're paving the way because the tidal wave is coming, and every step we make forward today is going to make it easier when that tidal wave hits as our nation ages.